So we just opened at Penn State Hershey a $54 million data center, University Technology Center is what we call it. That's in partnership with Penn State University, which is about 100 miles distant from the Hershey campus. They're building another, and they'll be opening in the next few months, another data center. And one of the primary operational goals is to be the disaster recovery site for each other. We, in essence, have saved some money by not having a third or a fourth disaster recovery site for each one. Will become each other's DR site, so there's an operational benefit. When we speak of why did we do a data center, again, there's operational benefits, but it really does get to our research mission of what we're trying to accomplish in genomics. And we have a world-renowned researcher with zebrafish DNA, and he's got petabytes of storage and data that we need to be able to make space for, and then high-performance computing to be able to spin that and turn that. There's some significant imaging research going on as well at the university. We'll be bringing that back. And then our real goal is we've opened up the Institute of Personalized Medicine 2 years ago, I believe it is. And whereas most of that is still a research protocol, in short order, we hope to make it a clinical protocol with the intent of providing for every patient coming through the door, if they so allow, we'll do a genomic profile on them. And for the things that we can deal with that are known today in the clinical realm, we'll link that to the electronic medical record, but we'll actually hold it to watch for as other things are discovered in the genomic profile. And that is a lot of data to both store, maintain, and to spin. So we're really driving hard for additional research and grants. We also are a major collaboration site in our Clinical Translational Science Institute with other organizations such as Hopkins and UPMC and Temple and others. And that's where, again, the data center will accommodate the ability to store not just our data, but large regional data sets as well. So one of the things, the guiding principles for the UTC was we will never again be a barrier to the business. Because our other data center, we'd always have to say, wait, give us 6-12 months, we'll get there, because we don't have the space or the power or whatever. That is no longer a barrier, and we're using it to really attract new researchers, and staff to the campus, and we're very excited for the future. Just linking that genomic data that we have to the electronic record so we can provide the feedback to the oncologist and others for better and more directed precision medicine is the goal. We're actually talking to a few other organizations that are affiliated with us about hosting their systems and their data, and then allowing us to integrate more tightly. We're also an emerging health system. We've recently acquired St. Joe's in Reading, and so we're bringing all of their information back. A lot of their image data and their PACS images are stored where the corporate center was in Denver. And so by default, we'll bring that back and begin to run it locally. But it really is, our goal is to become a regional center in a lot of the research and leverage the data that we have and the high performance computing that we hope to we have put in place at this point in time.